I'm Communications Director with the Committee to Protect Healthcare. We appreciate you joining us today on Halloween to hear from three Wisconsin physicians about how Republican legislators' actions and inactions on reproductive healthcare are harming patients across the state. Before we begin, I'd like to state that these physicians are speaking as individuals, not necessarily on behalf of any employers or other affiliated organizations. So we ask that you please respectfully refer to them in any coverage only as they introduce themselves on this call. Thank you in advance for that. Without further ado, I will introduce our first speaker, Dr. Hiddy.
Hello. So I'm Dr. Melissa Hiddy. I'm a family medicine with obstetrics physician, and I'm practicing in Green Bay. As physicians practicing in Wisconsin on Halloween, we're bracing ourselves to get spooked just like everyone else. This Halloween, we are confident that we can handle the haunted houses and even the rain. What has us terrified, however, is the stubborn refusal by the Republican majority in the Wisconsin legislature to make healthcare more affordable, more accessible, and more available. Republicans' refusal to protect our patients' freedom to make private medical decisions, such as whether to have an abortion, should send a chill down the spine of every Wisconsinite. When the Wisconsin legislature ended their session in spring, Republicans, who control the majority in the Senate and the Assembly, went home without taking action on important legislation that can improve health and save lives. While Republicans left important bills for dead, such as bills to expand Badger care and offer paid family and medical leave, the one proposal they had no trouble reanimating, like Frankenstein's monster, was one that could potentially endanger lives. They nearly passed a ballot referendum that would ban abortions after 14 weeks. Our patients may need abortions for all kinds of reasons before and after 14 weeks. Every pregnancy is different. Every pregnancy changes the body in significant ways, affecting different people differently. No two pregnancies are alike, and while some patients may experience a relatively uneventful pregnancy, others may encounter serious or potentially life-threatening challenges requiring complex interventions, and those interventions may include abortion. Regardless of the circumstances, Wisconsin women should not have their personal medical decisions made for them. By refusing not just to protect access to abortion, but trying to restrict it even further, Wisconsin's Republican politicians are putting lives at risk, and that's genuinely frightening to those of us working in healthcare. This Halloween, physicians across Wisconsin are concerned less about our patients' blood sugar levels and more about the direction of healthcare and access to abortion in our state. The stakes this Halloween and this election are real, and legislative Republicans' track record on healthcare in our state is scary. I'd now like to invite my colleague, Dr. McKinnon, to speak.
Hello, I'm Dr. Jennifer McKinnon. I'm an internal medicine physician in Milwaukee, Wisconsin. When the Republican majority ended the recent legislative session in spring, they left town faster than a vampire fleeing sunlight, just to keep on with the Halloween theme, because it is really scary. They abandoned many of the patients and families they're supposed to represent without relief on healthcare, on concerns like family and medical leave, and on whether their access to an abortion will be protected now and in the future. Just the other day, since I do teach medical students, I had a student describe having to witness a woman being forced to give birth to twins that instantly were going to pass away when they were born. And she had to carry full-term pregnancy and suffered preeclampsia, which is a very dangerous outcome of women, a leader of heart disease when women go through their life. And she had to carry the pregnancy the whole way through. So this is happening, and our trainees, including medical students, residents, are deciding not to come to Wisconsin because of our lack of action. Republican leaders continue to refuse to repeal an 1849 abortion ban that is still in our Wisconsin books, even though they have had 2 years to do so. And this is before even antibiotics were discovered, well before. At the same time, they've refused to take action to protect the health of moms and families after the babies are born. When given the choice to act on expanding Badger care, so more Wisconsinites will have access to health care, the Republican majority has done nothing. Given the chance to support a bipartisan proposal to expand Medicaid for low-income moms for 1 year postpartum, the Republicans in our General Assembly acted like they saw a ghost and they hid, and they didn't even pass a bipartisan proposal. They didn't even hold a vote. New mothers in over 46 states, including the District of Columbia, do have postpartum care for 1 year after the baby is born. This is much needed, especially with rates like postpartum depression and all types of complications that can occur in pregnancy. And these moms are trying to take care of their families. Yet Wisconsin Republicans have forced moms to suffer and struggle. This isn't all that the Republican legislators have refused to do. They have refused to vote on a bill that gives Wisconsinites the right to contraception and healthcare providers the right to provide birth control. Access to contraception is critical for many health reasons. As an internist, I have so many women on medications that if they were to have a pregnancy, the fetus would have major malformations and health conditions. This is why Wisconsin has now reported with the women in our state, they have less access to birth control and poorer quality of healthcare now in a survey conducted in 2022, ever since the extremist judges of the US Supreme Court struck down Roe and opened the door to not only abortion bans, but a lot of other things are on the chopping block, from mifepristone to birth control access. But the same Wisconsin politicians who have been playing dead when asked to pass important healthcare proposals have somehow sprang to life on a referendum to ban abortion at 14 weeks. Physicians have seen right through these political tricks, and so do Wisconsinites. We urge voters to keep this in mind, the inactions, lack of care in mind when they vote. I would now like to invite my colleague, Dr. McIntosh, to talk.
Yeah, thanks, Dr. McKinnon and Dr. Hiddy. Physicians have a bone to pick with Republicans who want to interfere in private medical decisions and prevent our patients from accessing the full range of healthcare, including abortion. A doctor's exam room has only enough room for the physician and their patient, not creepy politicians. We want our fellow Wisconsinites to know about the dangerous condition of healthcare in our state and hold politicians accountable for prohibiting them from accessing the healthcare they need and deserve. This includes the politicians who voted to block Senate Bill 365, which would have established the right to obtain contraception. We should call out politicians who push monstrous bills that would block healthcare facilities from receiving vital Badger care funds if they perform abortions. These same facilities also provide general pregnancy and women's health care, from screenings to preventative care that can detect problems early and save lives. We should demand better from our elected leaders and be watchful when they introduce efforts to redefine the word person in Wisconsin's Constitution to include embryos, as they did with Assembly Joint Resolution 130. The consequences of politicians meddling in reproductive care can have far-reaching and life-threatening outcomes. Abortion bans endanger lives, as patients in states like Texas, Florida, and Idaho are tragically finding out when they are turned away from emergency departments and are forced to give birth in restrooms. These draconian policies can even lead to death, as in the case of Amber Thurman, a Georgia woman who was denied care for 20 hours because of changes to the state law. Meddling with so-called personhood language can also shut the door for families seeking infertility treatments such as IVF. As physicians, we encourage our fellow Wisconsinites to remain vigilant this Halloween against politicians who want to keep Wisconsin's dangerous 1849 abortion ban in effect. Again and again, Republican legislators continue to push anti-patient measures, making healthcare less accessible and more costly for hardworking, low-income families. Republicans' anti-patient, anti-healthcare agenda is terrifying for many of our neighbors who have to choose between paying for their prescription medication and food for their families. As physicians, we will stand up for our patients in the exam room and at the ballot box and hold Republican politicians accountable for putting people's health and safety at risk. This Halloween, we recommend every Wisconsinite be vigilant about what their legislators do on healthcare and go easy on the Twix.
Thank you so much, Dr. McIntosh, Dr. McKinnon, and Dr. Hiddy. We will now open it up for questions. If you have a question for one or any of the physicians, you can chat your question in the chat box, or you can use the Q&A function. Sometimes the Q&A function works a little bit better on these. But so we'll allow a few moments for folks to be able to type those questions. I had one chatted to me. I'm going to put it in the chat box for everyone to be able to see. You mentioned that lawmakers have failed to extend Medicaid postpartum care. What sort of complications can arise for women in the year after childbirth, and how does not having health care affect that? And that's for anyone who wishes to answer.
So I still practice obstetrics. I deliver babies and I take care of moms and babies throughout their life. So in that year after having a baby, there's not only all the hormonal and physical changes that happen to mom, but there's all the things that happen with adjusting to parenthood. So we certainly in that first 6 weeks continue to see increased risk of things like preeclampsia, high blood pressure, blood clots. And then of course, like Dr. McKinnon talked about, we know that there's postpartum depression, anxiety, and those don't just magically disappear at the 6-week mark. Those can extend throughout those first months of having a baby into that whole first year. So when that coverage drops off at 6 weeks, that can leave those families struggling. So extending that throughout the entire first year really helps better cover the time period where families are adjusting, especially until babies are sleeping better and parents are just getting more adjusted to having life with a baby.
Yeah, like Dr. Hiddy said, I see patients frequently in the emergency department who have recently delivered, who have elevated blood pressures and risk for preeclampsia and eclampsia. Other conditions like gestational diabetes continue on after delivery, and not having healthcare for situations like that increases maternal morbidity and mortality even postpartum.
Thank you both, and thanks for that question. There's a question in the Q&A from Eric for all three. In addition to concerns about reproductive rights, can you speak to concerns about ACA future on the national level?
Yes, on the national level, the concern will be loss of pre-existing condition protections that the ACA made into law, enshrined. The other aspect would be care up until age 26, especially when kids are transitioning into their adult life, having access to everything from screening for sexual diseases to screenings for cancer at a young age, for pap smears, all of that coverage while they're going through college into their first job and whatnot will be dropped. Also screenings in general, the ACA protects all screening, whether it's a screening mammogram, a colonoscopy that's a screening, all of that would then start to go against somebody's deductible. And as we know, many people have very high deductible plans. That includes your annual exam, which the ACA protects. So that would be a huge blow, let alone Medicaid expansion in the states that did take it. That was a part of the ACA. In addition, we could then talk about the Inflation Reduction Act and the protections it gave to many medications for the first time, being able to negotiate the prices of meds like Eliquis, which I have many patients as an internist that take, and that medication literally costs $400 roughly a month for a Medicare patient, and all those negotiations will go out the window. I have patients that tell me they can get the same med in Canada for $100 for a 3-month supply, and I'm having to spend my time, instead of taking care of patients, faxing new prescriptions to a pharmacy in Canada instead of our own in the United States. So there's so many aspects that could go away.
Yeah, and to add on to that, I think just yesterday, Republican House Speaker Mike Johnson promised to essentially gut the ACA and to take healthcare away from millions of Americans. And as Dr. McKinnon was saying, that takes away your access to medications, that takes away your access to preventative health care, causing chronic conditions that are treatable, like high blood pressure and diabetes, to spiral out of control. And those are the patients that I see in the emergency department who come in with untreated chronic conditions, having heart attacks and strokes, and eventually dying from lack of access to health care.
It's really scary to us as physicians to think about the ACA getting repealed. I'm old enough that I practiced some before and now practicing currently. It's really frustrating when I have to look at a patient and say, this is the best thing for you. This is the best treatment or test or medicine, but your insurance may not cover it, or you may not be able to afford it. So we have to make so many decisions based on coverage, and it's really not fair to patients. Healthcare should be a right. Our country should continue to expand protections to healthcare access, and it's unacceptable to think that we could go back to where screening tests and vaccines and wellness visits may not be covered, or patients could be uninsurable simply because they have a pre-existing condition, potentially something they were born with or had in childhood that was really out of their control.
Thank you all, and thanks for that question, Eric. We'll allow another couple minutes for any follow-up questions or additional questions. Another question in the Q&A. After the Dobbs decision and before the court ruling allowing it again, abortion was mostly banned statewide under Republican legislative leadership. Can you share any stories of patients impacted during that time by the ban? And that's for anyone.
Yes,
Yeah.
I had patients that cross into Illinois, Minnesota. They come back and they may need further follow-up, ultrasounds or a shot of RhoGAM if they have a certain blood condition, which is quite common, where women need to have a shot so that they can have a future pregnancy and have a family down the road. And they have to come in and they're being sent back to another state, or in our state, you know, it's very tenuous. Planned Parenthood is protected, but it is quite difficult for me to have these conversations and think that I'm actually telling people they have to leave the state of Wisconsin.
Yeah.
My wife is actually a,
Oh, sorry,
my wife is actually a maternal fetal medicine specialist, which is essentially a high risk obstetrician. And she has clinic today, or she'd be on the call. But I've heard from her several stories of patients that had delayed care or were concerned about seeking care because other physicians had to talk with legal representatives from their hospital or transfer them to another facility because the legal representatives of their hospital said that they couldn't provide the adequate care. I've talked to a lot of my partners and colleagues about delays in care, and the emergency department, we want to diagnose and treat potentially life-threatening conditions like bleeding and sepsis that can happen with pregnancy complications as quickly as possible, because the longer that you delay that care, the higher the risk is for morbidity and mortality and bad outcomes down the road. And delaying any of that care can cause those conditions to spiral out of control to the point where you can't manage them.
Yeah, so personally, I had patients who were questioning if they could get access to abortion care in Wisconsin, and similar, I would have to send them to Illinois. I had at least 2 patients that had to go to Illinois, and they were fortunate enough to have access to transportation to time off work to be able to do that. But I also had many patients really floored that they and I couldn't just talk and make a decision, and I couldn't just treat them. I had to send them out of state. So it was really difficult at that time.
Thank you all, and thanks for that question. We'll allow another minute for any additional questions. In the meantime, I want to say that we have been recording this. So if you'd like a copy of the recording, please let me know either in the chat box, or you can send me an email where you RSVP'd, and I can get you a copy of the recording a little bit later this afternoon. But in the meantime, I am not seeing any other questions. I want to thank the media who were able to make time to join today. And thank you so much to our speakers, Dr. Hiddy, Dr. McIntosh, and Dr. McKinnon. We appreciate your time and your advocacy today at this very, very important time for the state and the country. Thank you.
Thank you for giving us the opportunity.
Yeah, thank you.
You're welcome. Have a great day, everyone.
Thank you.